What we tried to do was look at the excess cost of an employee who smokes and the excess cost that imposes on an employer compared to an employee who doesn't smoke. And what we found was that the excess cost was about $5,800 per year. And we got to that conclusion by looking at several discrete costs that had been studied previously. Those included excess absenteeism, excess presenteeism, which is a loss of focus at work related to nicotine addiction, and then healthcare costs and loss of productivity due to smoking breaks. Those were the four main factors that we looked at. And the largest amount was due to smoking breaks. If you look at smoking breaks, over the course of a day, if someone takes an extra 2 smoking breaks outside of sanctioned time, that adds up to about a half an hour a day. And over the course of the year, that can add up to a lot of lost productivity. Employers can help by providing cessation assistance to their employees. And for most businesses, especially for large businesses, it costs some money up front to provide that type of cessation assistance, but over the course of several years, it will certainly pay off. Most people who smoke do want to quit. There was a recent survey that showed that about 85% of current smokers have tried to quit at least once, and about 75% want to quit at any given time. So employees certainly want to quit and are looking for help doing that. A lot of times there is assistance available through the employer or through the insurance company, but employees don't necessarily know about that. So that's something that employees can look into and something that employers can do a better job of letting people know about. Ohio State is joining the national trend in becoming a tobacco-free campus. There are now more than 700 college and university campuses around the country that are tobacco-free, and an even larger number that are smoke-free and prohibit smoking. This is something that is clearly becoming the new norm, and Ohio State is joined by other Big Ten schools in going smoke-free or tobacco-free. And the transition to this policy raises a lot of questions that the transition to smoke-free policies has in other contexts. So people ask the same questions when bars and restaurants in Ohio and elsewhere went smoke-free. How is this going to work? Is it possible for it to be enforced? And what we found then and are finding in college campuses is there's a lot of anxiety, but once it goes into effect, people adjust to it very quickly, and it becomes the new norm around campus. And tobacco-free campus policies are incredibly important because college years are a danger set of years for smoking. If people can make it through the college years without starting to smoke, they are extremely unlikely to ever start smoking. So that's the real importance of this type of policy, that they can help protect the kids who are here on campus and prevent them from entering into what can be a lifelong addiction.